Today, we're going to talk about an important topic for both caregivers and seniors: coping with memory loss. Memory loss is something that many of us experience as we get older, and it can be really tough on seniors and those who take care of them. Sometimes memory loss is an indication of diseases like dementia, but more often, it's also just a natural part of aging. In this video, we'll be providing useful tips that seniors and their caregivers can utilize in order to manage loss of memory, improve their quality of life, and cope with the issues that result from it. Section 1. Understanding memory loss. Loss of memory is the inability to recollect information or recall events from the past. It can take a number of different forms, ranging from simple forgetfulness to serious mental impairment. Loss of memory can be categorized into many different types, such as 1. Short-term memory loss. This involves people forgetting things that have just happened. An example would be where they left their keys or where they had lunch. 2. Forgetting long-term memory. Loss of long-term memory is the inability to recall past events, experiences, or learned facts. This can be of greater concern, particularly if it interferes with being able to identify familiar individuals or locations. 3. Memory issues due to health complications. Alzheimer's disease, vascular dementia, or Parkinson's disease can lead to increased memory loss and problems with thinking. With those conditions, memory loss is usually accompanied by other symptoms like confusion, mood changes, or trouble with everyday activities. Memory loss can be frustrating, but it needs to be mentioned that not all memory loss is anything to be concerned about. Forgetting things from time to time is natural as one gets older, and there are things that can enhance memory. Section 2. Easy methods for elderly individuals to manage loss of memory. For elderly individuals with memory issues, there are a number of helpful measures to improve memory and make everyday life easier. Some helpful tips are: 1. Be organized. Having an organized environment is also essential in managing memory loss. The use of calendars, shopping lists, and reminder notes helps in remembering important things to do and appointments. Try putting often used items, like reading glasses or keys, in the same place each time. Stock footage idea: elders using a calendar or a checklist to organize themselves. 2. Utilize memory aids. Memory aids such as electronic devices, alarms, or reminder apps can be extremely useful. Set alarms to remind you to take medication, attend appointments, or complete daily tasks. Video concept: an elderly person with a smartphone or electronic device showing medication or appointment reminders. 3. Engage in mental exercise. It is so important to exercise the brain. You can do this by reading, puzzles, learning something new, or memory games. These all can make you stronger in memory and thinking. Stock footage idea: older people playing chess, working on crossword puzzles, or reading. 4. Make a time metablaving. A routine can eliminate confusion and improve memory. Attempting to eat at the same times each day, going to bed at similar times, and maintaining regular exercise can benefit memory. Routines provide structure and make it simpler to recall daily activities. Stock footage idea: older people following a regular daily routine, that is, making food or doing exercise. 5. Minimize distractions. Minimize distractions while you are attempting to recall something or complete a task can enable you to concentrate more. If you are having trouble recalling something, attempt to be in a quiet location with minimal distractions to assist you in focusing. Stock footage concept: a quiet and serene environment, with an older adult focused on an activity such as reading or writing. 6. Hydration and balanced diet. A healthy diet with the right nutrients could make your brain better. Foods that have omega-3 fatty acids, antioxidants, and vitamins may assist in protecting your thinking skills as you age. Being well hydrated is also extremely important for your brain to work. Video idea: older adults eating a healthy meal with vegetables, fruits, and lean protein. 7. Exercise. Regular physical activity keeps the brain healthy and active through greater blood flow. Older people can resort to walking, swimming, etc. Exercise also makes one sleep better, and this, in turn, can enhance memory. Stock footage concept. Seniors walking, swimming, or in a group fitness class. 8. Get plenty of sleep. Sleep helps with memory consolidation. Sleep 7-9 hours a night. If memory impairment is disrupting sleep, try to establish a relaxing bedtime routine or talk with a healthcare provider for further guidance. Video concept. An elderly individual lying in bed, preparing for a restful sleep. 9. Stay socially active. A social interaction and meeting people is very important for a healthy brain. Attending family reunions, town events, or chatting on the internet keeps the brain active and lowers the risk of memory problems. Video concept. Older adults conversing and enjoying themselves with friends or relatives at a party or at a community center. Section 3. What caregivers can do to help seniors with memory loss. Caregivers can play a vital role in helping elderly people who suffer from memory loss. Here are some useful tips for caregivers to manage the issues of memory loss and enhance the life of their loved ones. 1. Keep calm and listen. Forgetting can be frustrating for both caregivers and elderly persons. Be understanding and provide emotional support. Avoid correcting the person when they forget, but instead remind them gently and reassure them. Stock footage concept. A caregiver patiently and carefully helping an older person with activities of daily living. 2. Establish a safe and nurturing environment. Make the home safe and simple to get around. Remove tripping hazards, add grab bars or handrails, and ensure the person can reach necessary items without trouble. Safety features can avoid mishaps and help the older adult feel more relaxed. Stock footage idea. A helper cleaning out a senior's home or putting in safety measures like grab bars. 3. Encourage self-sufficiency. Needs to help the elderly, but also needs to get them to do things on their own. It gives them confidence and a feeling of achievement. Stock footage concept. An assistant assisting, but allowing an older adult to do things for themselves, such as getting dressed or preparing a meal. 4. Maintain a routine together. Help the older adult establish and stick to a routine. This can make daily life easier for you both and reduce anxiety or feelings of disorganization. Establish routine times for rest, activities, and meals. Stock footage idea. A caregiver and an older person enjoying daily tasks together, like meals or walks. 5. Monitor medications. If the elderly person is taking medication for memory loss or any other medical condition, closely monitor them. Create a schedule for their medication and make sure they take it as instructed. If there are side effects or memory lapses, talk to the doctor. Stock footage option. A caretaker sorting or managing medications for an elderly individual. 6. Seek professional assistance. A caregiving can be emotionally and physically demanding. It is important to seek help when you need it. Joining a caregiver support group, discussing your concerns with a healthcare provider, or investigating respite care can alleviate stress and prevent burnout. Stock video idea. A caretaker in a support group or talking to a physician for help. Section 4. When to see a doctor for memory loss. While mild forgetfulness is normal as people get older, it's a good idea to see a doctor if memory problems are affecting everyday life, or if the person is having more serious thinking problems. Some signs that medical help is needed include profound loss of memory affecting everyday activities, difficulty identifying loved ones or familiar locations, increased confusion or disorientation, changes in behavior, mood, or personality, difficulty in speaking or understanding words. If any of these symptoms are experienced, it is important to see a healthcare provider who can perform a thorough assessment, diagnose, and recommend a proper treatment regimen. Conclusion. In conclusion, it is difficult for older people and their caregivers to deal with memory loss. However, with the help of effective strategies like being well organized, having an active body and mind, and creating a supportive environment, it is possible to enhance life and deal with memory loss better. Action, empathy, and patience are important in facilitating older people to live well in after developing issues with their memories. Thank you for viewing today's video. We can all help make getting older a bit easier.